I'll start. I wanted you to elaborate a little bit on what you touched on in there. I was walking out as someone asked a question about the NIH funding that was available in ERA and how that money may not be available after it runs out.
Well, the $10 billion that was additional NIH money is time limited. It was a major increase in investments. What we're also concerned about as we look toward the future is that we make sure that the cutting edge research going on issues like obesity, but a whole range of issues and cures is not jeopardized by slashes in the NIH and other health budgets. So I think we know that the Recovery Act money was time limited, but the NIH budget is very critical to research going on around the country. I just met someone from the Heart Institute.
Jackson Heart Study.
Jackson Heart Study, which is a big grantee of the NIH, and we need to make sure that programs like that continue on.
Madam Secretary, well, we see a resurgence of the traditional home economics classes in public schools, that sort of thing.
I think there's no question that a lot of folks have turned more and more to fast food, processed food, prepared food, and not only don't have time to cook, but often don't really know how to cook any longer. And everything from reintroduction of programs in schools that give kids the tools to both not only learn how to cook, but learn what various foods do to their body. So health classes and nutrition classes, but also physical education and feeding in school cafeterias, looking at much more healthy choices. So there's a whole range of school-based efforts that I think can have a huge impact on the next generation.
I have kind of a follow-up to that. Fast food, processed foods, things like that are oftentimes a lot cheaper to get than something grown organically and on budget, and poor people suffer from obesity the most. How do you change that business culture? Is there a way to do that?
Well, I think that's one of the big challenges. Often, fresh fruits and vegetables aren't easy to access. They are often more expensive, and they take some time. So it's the triple whammy, and I think that part of the effort with some of these community projects is looking at what some of the key issues are. Subsidizing fresh fruits and vegetables, subsidizing local farmers to actually produce more is kind of a win-win situation. So you connect local produce to a local market. There's a lot of effort going on with local chefs and schools, again, to tie those together. And the bill that's pending right now in Congress recognizes that, for instance, school lunch programs are right now operating on the same budget. I think it's $1.25 that they've been operating on for a number of years, and that financially needs to be updated so that there's a little more resources to actually buy healthier foods. So part of it is information, and people, again, I find all over, want to make good choices, and we make it really hard and really complicated for people to figure out what actually is a healthier choice, what is a better choice. So food labeling is also part of it, giving people easy to read, easy to understand information.